Hello, this is Shannon Sazi, and this is my journal entry 5, part 1 of 3. Over the past 4 self-reflective videos, I've described various patients, their diagnosis, treatments, progress, and my response to these patients. In the first video, I talked about a 43-year-old male patient that had a diagnosis of schizoaffective disorder, bipolar type, and a new diagnosis of OCD. Although he does not work, he has genuine symptoms that make it impossible for him to hold a job. And he is on disability. This patient supports himself in his own apartment and is receptive to new treatment techniques to control the OCD. Despite his mental diagnosis, he continues to help himself and his family. I find my empathy and compassion for this patient at a different level than for the following 2 patients. The second video, I spoke about a female patient that also did not work and lived with men that would take care of her. This patient had diagnoses of depression, anxiety, and extreme poverty, but no medical diagnoses. The frustrating part of this patient is that she did not want to do anything to help herself. For months, she would come to her visits complaining of her situation, but she was non-compliant. The obvious conclusion is non-compliance for this patient, but through self-reflection, I wonder how much is actually just worsening depression and hopelessness versus only non-compliance. There are always 2 sides to a scenario, and it's easy to get stuck in a negative rut and to not see the problem for what it might actually be. This is the end of my first part.